Tamara DuBose, and this is my presentation for the Teaching and Learning Strategies YouTube presentation. What we're going to do today is we're going to demonstrate how to build a concept map in either a classroom setting with student or novice nurses, as well as in the hospital setting with more experienced staff nurses. So the reference group for this particular concept map is going to be in the hematology oncology pediatric setting, in which we have staff nurses with varied levels of experience. The objectives of this lesson are going to be, first of all, to paint a big picture of all the concepts that this particular patient that's newly diagnosed with leukemia may endure, and then we're going to build a few different things under each domain that we select to discuss today. So can anybody tell me one domain that they can think of that this patient may endure, or that may fit into this picture for a leukemia patient?
Certainly treatment.
Treatment regimen, okay. And so what types of things might this patient endure under their treatment regimen?
Chemo, definitely.
Chemotherapy, okay. Any idea of what types of chemotherapy they may receive? Any thoughts on?
Vincristine.
Okay, Vincristine.
Dono.
Okay.
Steroids.
Steroids, and that actually falls under another regimen. And let's list one more.
Get, like under sedated procedures like IT, ARC.
Okay. Procedures. I'll put that over here because my handwriting is big. So procedures, and I'll just put in parentheses sedated. Okay, so those are a few good options under the treatment regimen. So what other domain might this patient, might be related to a leukemia diagnosis patient?
Psychosocial.
Okay, psychosocial. Okay, so what types of things fit under this domain? What might this patient experience under this domain?
Issues with family dynamics.
Family dynamics. Can you think of any examples of family dynamics?
Just how the parents are dealing with this and whether they come from a single family home or if it's affecting aunts, uncles, grandparents.
Right, everybody included.
Siblings.
Siblings, that's actually a good one. What other things might this patient endure under psychosocial domain? What things might fit under this domain?
Body image changes.
Body image, okay. What's the big body image thing that they may have to endure?
The hair.
The hair, right, and of course that is related to the treatment regimen, so you can kind of see how we're starting to pull this together. Can you guys think of one more thing under the psychosocial domain?
Financial strain.
Financial strain.
Maybe one parent has to stay home from work to help take care of the child, or paying for parking.
That's an excellent example. Okay, can anyone think of another domain?
Complications of treatment.
Okay. Okay, and what type of complications may this patient experience?
Medication side effects.
Okay. I'll just put med side effects. Can you think of any off the top of your head?
There's a ton. Blood pressure issues, nausea, vomiting.
Nausea and vomiting, that's a big one with chemotherapy drugs. What other complications may fit under this domain?
Bleeding.
Bleeding, okay. What would the bleeding be as a result of?
It can be several issues like their blood counts if their platelets are low, or from the sedated procedures.
Okay.
If they have any issues from that.
Okay. And let's list one more under complications.
Infection.
Infection, and what may that be a result?
From neutropenia, from their counts being low, and central lines, just invasive procedures.
Okay, and so further pulling the concept map together, what might the bleeding and the infection be a result of? Like, which other domain may this be related to? Treatment, so their chemotherapy. These are all side effects from the chemotherapy drugs that the patient may receive. Okay, so let's think of one more domain to discuss for this particular patient.
Education.
Education, okay, that's a big one. Okay, Okay, so what educational needs might this patient have?
About their counts,
Okay,
example, their counts dropping with issues with anemia and neutropenia.
exactly. And so what might those things be related to? What other domains on this concept map might the counts dropping in that
Could be
education?
treatment regimen
Treatment regimen?
or complications also.
Complications, exactly. Can you guys think of another educational need that this patient may have?
Medications that they might be going home on.
Medications, right. So what types of things around medications might they need to know?
Side effects.
Side effects?
How to give.
How to give,
When to take them.
when to take them, exactly. Those are all good examples. So let's think of one other thing under education.
Infection prevention.
Infection prevention. And what types of things might they need to be educated on under infection?
Hand washing.
Bathing.
Bathing,
Mouth care.
mouth care, okay.
Avoiding sick people in crowds.
Right. And so what might this particular need, infection prevention, be related to? Like which other domains or concepts on this concept map might the infection prevention be related to?
Treatment and complications.
Treatment and complications, exactly. So we basically have just demonstrated how building a concept map can facilitate a discussion inside of a classroom as well as on various hospital units. And it really provides the nurses involved or the students involved the opportunity to really think through the different domains that are related to this particular diagnosis or any other diagnosis, and decide which three things under, not three, but it could be a higher number, but which things fall underneath that regimen, and then they can also visualize how it relates to the diagnosis as well as other concepts on the map. So I appreciate you guys for your participation, and I hope that this has been a good experience for you guys.